Testing.
Hey, can you hear me?
Yes, I can hear you.
Oh, awesome.
Can you see the screen?
Yeah. Hope you like my beach cottage.
Oh, where are you?
I'm in the Tahoe.
Oh, nice. Thanks for joining.
Yeah. No, of course, man. Definitely dealing with a little, we just got up yesterday and I'm dealing with like the altitude adjustment. Like I feel just groggy.
Yes. I think we have a full webinar. Let's just get started then.
Do you want
It's
me
gonna
to
go live on Google.
Okay.
On
Do you
YouTube.
want me to turn off my video or
No, you're good. You're good.
mute it? I'll keep myself muted until you say something to me specifically.
Let's see. Let me just share my screen. Are you seeing my screen or myself?
I'm looking at your screen. Webinar plan.
Hey everyone, I'm Gerardo. I'm the founder and CEO of Chartnote. Welcome to the webinar. We're gonna give you a brief overview of what you can do with Chartnote. So we're gonna start first with an introduction of our 5 main features. The main one is gonna be the AI Scribe. This one you're gonna use to record the doctor-patient visits, and then the AI is gonna create a clinical note in less than a minute. And voice chart is uses the same technology, but what we do is you record yourself and pretty much dictate a note, just like doctors did it 10 years ago. After seeing a patient, they will call a number to leave a recording, and then a transcriptionist will give them back the structured note in a few hours. So now we can do it in just a few seconds. That's a voice chart. And then inside Chartnote, we have something called Copilot. And Copilot, what it does, it gives you access to pretty much ChatGPT, but in a secure environment and in the context of your notes. So you can ask follow-up questions, ask maybe for differential diagnosis, ask to write a referral letter, anything you can think of. Then we have regular dictation. This is kind of like your Dragon dictation, and this is live speech to text. And I think most of you are familiar with this kind of dictation. And then the dot phrases, we call them snippets. With snippets, you write an abbreviation, and then you get a snippet of text. Let's see. Let's see. Something like this. Anyway, let me log in. You can create a free account. We have a freemium business model, so anyone can create an account. You don't need to talk to sales. You don't need a demo from us. Let's see. Okay, so this is what you're gonna see when you first log in. Probably the left side, it's gonna be empty because this is where all your notes are gonna go.
Hey,
You're gonna
Geraldo.
see, yes.
I don't think you're sharing your screen.
Let's see. Let's see. Okay, can you see my screen?
I think so. Yeah, I see both our faces, and on the left-hand side. Oh, now I see it. Yeah.
Okay, perfect. Anyway, so this is what you're gonna see when you log into Chartnote. This you're gonna see three main buttons here: the voice chart, AI Scribe, and note template. On the left, you're gonna see all your notes that you have been creating, and then some settings on the right side. So let's get started with a demo of an AI Scribe. Now you can record on your computer, or if you prefer, you can use download the app Chartnote Mobile on the App Store, and obviously gives you more mobility. You can go from room to room just carrying your phone. So for this one, I'm gonna use my phone, and Austin is gonna be my patient today. So I'm gonna click New AI Scribe. I'm gonna first ask for permission to record. So Austin, is it okay if we record this?
Yes.
Okay, so we're using this app to, this is usually my spiel with the patients. We're using this app to record our conversation, and then the AI is gonna create a note for me, and it's gonna help me to pay more attention to you. So by default, it's gonna select a SOAP template, but you can change to an HMP or an APSA note. We have several other templates for ED physicians, mental health. You can also create your own. The setting, if it's in the clinic or in the hospital, the type of visit, if it's an initial visit or follow-up. So you have options to select. If you're conducting the visit in a different language, we have more than 30 languages that you can select from. If you want the AI to suggest some billing codes, you can select this, and the note will come with billing codes. So, okay, so assigning a patient is optional. You can also just type a brief note here. For example, I'm gonna write the name and the age, since sometimes this is not something we're gonna discuss during the visit. But anyway, hit record. Hey, Austin, I'm Dr. Bonilla. How can I help you today?
Hi, Doc. Yeah, I'm having a lot of pain in my left hip, and it's been an ongoing issue. And I kind of stumbled upon it. I've had 2 ACL surgery, reconstructive surgery in my right knee, and I think I've compensated a lot. So I've got a lot of hip pain in my left hip. I've had it for a couple of years, and learned through physical therapy, ironically through I was receiving for my knee, and learned some things I could do for my hip, but it's becoming a chronic pain issue where I can't stand. I've noticed just this past week, my family and I went to Disneyland, and we were dealing with some long lines, and as soon as about 2 or 3 minutes just standing still in line, I just would notice a lot of pain in my left hip.
I see. And so let me just try to make sure I'm understanding. You started with right knee pain?
Yeah. So when
ACL?
I'm currently 42 years old, and when I was 23, I had a basketball injury that resulted in a torn ACL, and then had surgery, and about 3 years later, tore it playing flag football, and had the surgery. It wasn't quite as successful the second time, but basically I've spent about 1.5 years of my life on crutches, and I don't know if it's subconscious, whatever, but I've always put a lot more, since those injuries have happened, I've always put a lot more weight on my left leg, and I noticed that.
I see. Okay, that's what I wanted to clarify. So the pain is in the left hip. So you're trying to
Hip, yeah.
Okay, and this has been going on, the left hip pain, for how many weeks?
It's been going probably for about 2 months, but in the last 2 weeks, I've really noticed that even the things that I would normally do, the stretches and things that I would do to try to alleviate the pain, haven't. And for the first time ever in my life, I've had to try to ice my hip, which is a really awkward thing to do. But yeah.
I see. Any injuries recently?
Nothing at all. I even recently bought a recumbent bike to help kind of see if that'll alleviate some of the pain. But again, it's not as much when I'm walking or biking or anything like that. It's when I tend to end up just standing still.
Okay. Any other medical conditions? Any diabetes, high blood pressure? Do you take any medications?
No, I mean,
No.
my BMI has gone up a little bit, but I probably I've put on about 15 pounds in the last 2 years. That's about
Yeah,
it.
I see your weight today. It was 195. It went up 5 pounds since our last visit
Okay.
6 months ago. So, and what's your height?
I'm 6 feet.
Okay, your blood pressure today is 120 or 80, so that's good. Anyway, so let's do a quick physical exam. Why don't you lay down here on the table and let me palpate your hips. Does it hurt if I press on the left hip?
There's a little tenderness.
How about the right hip? Does it?
No, the right hip. Yeah.
Okay, perfect. So let me just move it around, and I can feel a little bit of clicking there. Who knows? Let me just do this thing we call the roll test. Is that tender?
Yeah. It is a
Yeah.
little.
Okay. So let's do this. I'm gonna give you some ibuprofen to take for a couple of weeks. Just take it twice a day, and you can take it up to 3 times a day if you're in pain. And I'm gonna order an X-ray of your hips and probably also your knees, just to see how they're looking. I want to see if you have some arthritis. It's possible that you have some arthritis. If you do have arthritis, you have a few options. You can continue with the physical therapy. We can do a steroid injection. So, but why don't we schedule a follow-up appointment in a couple of weeks, and then we can. I'll call you with the results of the X-ray, and I'll tell you a little bit more about the plan.
Awesome. Thank you.
Excellent. Well, perfect. So let's hit transcribe, and it's gonna show that it's processing here, but whatever you see in the app is gonna be mirroring on the web app. So you can see here it's processing, and the idea ultimately you want to transfer the note from Chartnote to the EHR. So let's see, it took less than a minute, and you get a pretty accurate note. You obviously want to double check. For example, I noticed that he said it's 42, and there was some conflicting information there. But anyway, you want to just read it. You might want to do some light editing. Obviously, you can type. Let me just zoom in so you guys can see. And you can also dictate. So you see this microphone here. This is the regular dictation that I was talking about. Patient also complains of his big toe hurting, period. Next line. Anyway, so that's dictation. You can also insert snippets, the dot phrases that I was talking about. So you can search for a snippet here in the snippet section. Let's see. I'm going to look for an exam. Hip, let's see, hip exam. Let's see if we have. Well, we have a hip fracture. Anyway, but you can also do it as you type. So those are the templates and dot phrases. We call them snippets. Once you have the note, you want to copy. You can copy the whole note clicking this button. But if you want to copy section by section, depending on the EHR, for example, I have a demo EHR here. It has 4 sections, so you probably want to go one by one. Copy, paste, and the other option that we have, if your patient doesn't want to be recorded, you can always use voice chart. So let me do a quick demo, and I'll be brief here. Same thing, you select your options, And here you use dictate your note. This is a 42-year-old male with history of 2 right ACL reconstructions and presents to the clinic complaining of left hip pain. He thinks he's compensating because of his right knee injury. The pain exacerbates when he stands for a prolonged time. And he's overweight. And on exam, there is some crepitus on his left hip, standard to palpation, positive roll test, assessment and plan, left hip pain, possibly osteoarthritis. We'll order an x-ray. He has history of 2 ACL reconstructions. We'll get an x-ray and follow up in 2 weeks. I recommended some ibuprofen and conservative management, including physical therapy. So the same thing, you can do this on your phone. And then the note is gonna appear in just a few seconds. Let's give it a minute. Let's see. So one of the things, here's the note. One of the things that I want to show you is how to use Copilot. So here we have the Copilot tools. So let's say that we want to tell the AI to generate an after-visit summary. We click here, we select if this is for the patient, the level, and the language, and then the AI is going to start generating an after-visit summary just to inform the patient what they're supposed to do. So this is helpful for a complex visit, and you can ask anything you can think of. Help me create a physical therapy program. Okay, so it's fascinating all the things that you can do. Okay, let's move on to. So sometimes everyone has their own style and documentation. Maybe you want the HPI in a bullet point style. You might want the plan and the assessment plan to be combined. Who knows? Everyone has different different styles. So we have this thing we call custom AI templates. So if you go to the library and you go to the AI-powered note templates, here you can create your own note, your own template, and you can give custom instructions for the note, create your own sections, give custom instructions for each section. For example, if this was the subjective, I wanted to use bullet points, and I want you refer to the patient by the first name. Things like that, little details. It can be as complex as you want. You can put conditionals, like if I said this, do this. You could put like a template and ask it to adjust depending on the visit. So it's really powerful. Let's see. The other thing that you're going to see here is the snippets. By default, all the accounts come with preloaded with 1,000 snippets and dot phrases, but you can create your own. And then we have a community. So when you create a snippet in Chartnote, you can share it in the public library, in the community library, and then other people can use that and edit as snippets. So that's a neat thing we have in Chartnote. Let's see. The other thing that we haven't discussed is just if you want to create a note from scratch, just using dictation, typing, and dot phrases, you can always go here, open a note, and you have a plain note that you can start documenting. Another thing that I wanted to tell you about is we currently don't have integrations with EHRs, but we do have a Chrome extension that can interact with any web-based EHR. So for example, I have this EHR, and what I'm going to do, I'm going to Google Chrome extension Chartnote, and the first result, it's super easy to install. It's just one click, and then you're gonna see here in the let's see. I mess up. Can you see my screen?
Yeah. Let's go back and forth between you and I. I mean, I'm not seeing your screen. Sorry.
Okay. You can see me?
Yeah.
Okay. Okay. So I was installing the extension. So this is the extension. You probably want to save it as a favorite. Let's log in. And you have a condensed version of Chartnote right there on your web browser. So let's log into the EMR. Let's see. Okay, so what you can do with the extension is insert snippets. So if I click here, it's going to insert a block of text. You can also do it as you type. So if you remember the abbreviation, you type the @ symbol and then hit tab, and it's going to expand the snippet. If it's a complex snippet with optionals and drop-down menus, it's going to open this pop-up. You can edit it and then insert. You're going to see this. You can also dictate. You can turn on the microphone. And let me move this. Let's see. On exam, patient in no acute distress period. Oh, let's see. Patient in no acute distress. If you wanted to, let's say you don't have a microphone in your clinic or hospital computer, you might want to sync your phone. So you show the QR code, and then on your phone, you're gonna go on the right upper corner. You see this QR code. Gonna open this page. It's gonna ask to select whether you wanna link with chartnote.com or the Chrome extension. Here we're selecting the Chrome extension, scan the QR code, and then you're good to go. Let's see. Let's turn on the microphone. Lungs are clear, period. Excellent. So you can insert voice commands. It's pretty much Dragon. We have this pretty much the same capabilities. So talking about microphones, you can also use this in Chartnote. So if you're in the note and then you go to settings here, you can also scan the QR code and then link your phone with the device. But depending on the computer, for example, if you're using a desktop computer, usually the internal microphone is really bad. So you probably want to connect a USB microphone. Now, if you're gonna be mainly dictating, you want something that is close to your mouth. I like using a gooseneck microphone. Gooseneck USB microphone. Something like this. Now, if you're gonna be using AI Scribe, you wanna use something called omnidirectional, and buy it on Amazon for less than $25. Something like this, and it's gonna record the whole room. So that's a good option, and you can always use the phone, obviously. obviously, if you don't need to buy anything. Some other tips regarding audio: if you're using AI Scribe for televisit, we recommend that you just don't use a headset and use your phone to record the visit. So especially if you're using Google Meet, we have some audio issues we're gonna fix, but at this point, we do recommend that you use the phone. And then if you use a headset, the Chartnote is gonna record your voice, but it's not gonna record the voice of the patient. So that's important to know. Let me see. If you guys have any question, feel free to ask in the Q&A section. Austin will can interrupt me. Let's see. So what's coming? We're gonna start working on EHR integrations the second half of this year. We're gonna start with Athena, Practice Fusion, Elation, and then we'll go from there. We have 24/7 support. You see this bubble here. You can chat with our support team. There are also good video tutorials. You can click here. We have a help desk with some helpful articles. And if you go here to settings, you can always, let's see. Oh, okay. So we have several tiers in our plans. So you're gonna start with a free account, and then we have a premium, professional, max. Premium is basically to have unlimited use of the dot phrases, the snippets. The professional basically has unlimited speech-to-text dictation, like Dragon style dictation. And then the max has unlimited AI Scribe, voice chart, AI use, and the Copilot. If you buy a yearly subscription, you get a good deal in terms of a discount. And if you have a clinic and you want to onboard your own team, you can also do that. You have unified billing. You can add and remove users easily. We also open. We're HIPAA compliant, and we offer business associate agreements. So anyway, thank you for your time. If you have any questions, feel free to ask or send me an email. There's also this button here in feedback. If you have anything to share with us, we are all ears.
I did have one question. Can you hear me? Oh no. Could you hear me?
Excellent. Any questions in the Q&A?
No, there wasn't. I did have a question for you.
Sorry, you're muted, Nelson.
I'm muted?
Can't hear you.
Can you hear me now? Not at all? Testing.
Anyway, okay. Well, thank you for your time.